All right. Everybody good? Y'all see that? I'm going to pull up my chat box to make sure you are with me. Okay. So an overview right now, housing in America. As most of us probably know here, affordable rents are just ridiculous right now. There are hardly any properties with affordable rent, and so no state has an adequate supply of affordable rental housing for low income renters. And you can see here that the states in red are the ones that have a really low stock of affordable housing. So Florida, Texas, California, those of you Alaska, those folks have a really hard time. And then you can see the other areas that are a little bit better. But we know that nowhere in America can you afford a one bedroom, decent place to live based on minimum wage right now in America, which is just a horrible problem. And so it leads to people paying far more for rent than they're able to. And we see a crunch there. The pandemic has added to this. And so this data is from September of last year, but we know that it's gotten even worse. But 1 in 6 renters aren't caught up on their rent during the pandemic. And with people of color, particularly Black and Asian folks, facing the brunt of this, of being behind on their rent. And as you may be aware, the Trump administration and now the Biden administration have issued an eviction moratorium, which is great, saying that folks can't be evicted for not being able to pay their rent. However, that doesn't mean that folks are exempt from paying rent. So it just means that folks can't be evicted for not paying their rent. So what's potentially going to happen is that some people who are saying, oh, I'll pay rent next month, are going to have several months rent come due at the same time. And we're going to see a lot of people needing a lot of assistance right at once. So that's COVID stuff, right? Now, for homelessness in America, I think that this should just make all of us so angry and outraged. There is an estimated 100,000 people, Americans, living with HIV who are currently experiencing homelessness. This does not mean that this doesn't include folks who are couch surfing, or these are folks who are just homeless. So 100,000 people estimated living with HIV who are homeless right now. And as we know, it's not just a matter of HIV, but experiencing homelessness means that you're at higher risk for tuberculosis, hepatitis C, and now COVID. So I see that a question has come in, which is great. Put your questions in and we'll get to all that at the end. Okay. But feel free to use that as we go. So on just homelessness and health, we know that people experiencing homelessness contract COVID-19 are twice as likely to be hospitalized, 2 to 4 times as likely to require critical care, and 2 to 3 times as likely to die than others in the general public. And I think that, for years, we have been saying that housing is healthcare in the HIV space. And hopefully folks in America are starting to see that, knowing that, putting a whole bunch of people into a shelter isn't a solution, right? And that's not a way to keep people healthy. We know that people who are experiencing homelessness do wind up in the hospital more, do have worse health outcomes. And this is true for HIV and it's true for COVID. And we've got to find a more sustainable way to provide housing to low-income Americans. This is just a little status about aging and homelessness. Because so much of the HIV population is aging, it makes sense that we should pay attention to how this affects folks' housing as well. So a third to one half of persons in a shelter in New York are over the age of 50. And this number continues to trend upwards. So a third number was a couple of years ago, and it's becoming more to about a half of persons are over 50. And then homelessness is greatest among people over 40. There are a good chunk of youth homeless. It's not that this, but I'm just talking about overall. What we're really seeing is that most people experiencing homelessness are over 40, and people who are I think it's 50 are considered geriatric if you're homeless, because it is so the health outcomes are so bad for people who have to spend years living on the street or in shelters. So this is really something that we need to be paying attention to as an HIV community, is how we're prepared to support housing for folks who are living with HIV and who are aging. So this is the unmet need, 400,000. 400,000 people who are living with HIV are estimated to be in need of housing supports and are not getting it. 400,000. So as I said, we have 100,000 who are experiencing homelessness, but that 300,000 are people who are spending way more money on their rents and then maybe not being able to afford transportation or core medical services or different things, right? Or they're couch surfing, or not even reporting that they're homeless when they are. It's certainly a squeeze here, but HUD's estimate. So this number, this 400,000, comes from HUD, that they estimate that 400,000 people are eligible for HOPWA. And that means people who are extremely or very low income and living with HIV. So again, I'm glad that all of us are here in the session, because this is so important. If we're going to end HIV in America or in the world, we have got to pay attention to housing and investing as housing, not only as treatment, but as prevention. So this slide is data from the Ryan White program. And so these are Ryan White clients and their housing status and viral suppression. So these are AIDAP clients. And as you can see, for stably housed Ryan White clients, they achieve 88% achieve viral suppression. And for unstably housed folks, the number is 72% are virally suppressed. And I know that viral suppression is not always the best marker. I understand that there are flaws to that. But I do think that this gives us a snapshot into the disparities and health outcomes that we can see. Ryan White, so getting their meds, right? Connected to care, able to get meds, 88%. Viral suppression, stably housed. Then you see 80.7 for unstably, and then 72% for not stably housed. I just can't get over that slide every time. So HOPWA. I know that many of you are probably familiar with the HOPWA program, but just want to give a little bit of data on HOPWA. And I'm going to pull sorry for the delay here. I want to pull up the chat. My chat box went away, and I want to see what y'all are saying. So hold on one second.
Hey, Lauren, it's Ashley here. If you go up to view options at the top, there should be an option to show that toolbar.
Thank you. I got it now. Thank you so much. Okay, great comment from Paul, and we're going to get to all those. All All right. So HOPWA. HOPWA is the Housing Opportunities for Persons with AIDS program. We call HOPWA. It's 28 years old now. And HOPWA started at the beginning of the AIDS crisis and really was a place for people to go and spend their last months or year alive in a comfortable place, especially as people were getting kicked out of their homes. People were afraid of AIDS. And it really was like a triage service. Instead, now HOPWA thankfully has been a program to support people living with HIV and to help ease some of the housing burden that people are experiencing. So some stats on HOPWA. Approximately 150,000 households receive HOPWA housing assistance or supportive services. And I'll go into a breakdown of what that actually covers. And then 8 out of 10 beneficiaries are extremely low or very low income. So that means that 80% make 50% of the average median income in an area or below. So that's HOPWA really serves people who are having financial trouble. And then among new clients receiving direct housing, about 19% were homeless and living with HIV. So about 1 in 5 new HOPWA clients were experiencing homeless before coming into the HOPWA program. And then, I just some of the age stuff, as I've shown, 45% of HOPWA clients are 31 to 50, 41% are over 50, and HOPWA primarily serves communities of color, 55% Black, 35% white, and 16% Hispanic or Latino, and then smaller populations of Asian persons. So HOPWA meets a need, right? The 150,000 households, but we know that there is so much more need out there. Eligible HOPWA activities, HOPWA is able to provide facility-based scattered site housing, permanent housing placement, housing information services. HOPWA is able to provide money for food, for transportation, child services, and more. So let's see. So HOPWA implementation, as you can this is just a quick snapshot, 70% of HOPWA money goes directly to housing assistance, 70%. And then 19% goes to supportive services like transportation and food, et cetera, et cetera. And then there are 140 formula jurisdictions and 82 competitive renewal grants and 6 competitive spends grants. What this means is that HOPWA has set cities that and jurisdictions, counties, states that the money gets funneled through. And this means that some areas don't get any HOPWA funding because their city or state isn't big enough or doesn't have a caseload of living HIV that gets them to that HOPWA point. And then so there are some competitive grants that help to fill those holes, but some areas don't get HOPWA. And some what jurisdictions get is a fixed amount based on your living HIV cases, and we'll get to that when the formula. So this is the old HOPWA formula, and I don't want to go way too in the weeds here, but this was the formula from 92 to 2016, and it was based off of cumulative AIDS cases. So for those who have been around for a while, have heard us talk about this HOPWA modernization, and it really, the modernization changed the old formula, this cumulative AIDS cases, to changing it to living HIV cases. Because in cumulative AIDS cases, right, that counts everybody who's had AIDS since the beginning of time. And then, so yes, Devin Hursty, living cases, that means you, people living with HIV. So this is some of the CDC language that we are using from the old formula. So that was the old formula. And then folks worked really hard to change the formula so that it wasn't about cumulative AIDS numbers, but instead it was about people living with HIV who are the ones who absolutely need housing. No, you do not have to have an AIDS diagnosis to qualify for HOPWA. I'm looking at the chat a little bit here, but no, you can have you can be living with HIV and get HOPWA. You do not need an AIDS diagnosis. But the main thing here is that the formula changed so much so because we went from cumulative AIDS to living HIV. And when we did that, it meant that some of the jurisdictions that had a whole a large number of AIDS populations now we're going to okay, I will slow down a little bit. When we did that, it meant that places like San Francisco, New York, some of the other places that had AIDS cases, high AIDS cases, are not going to get as much now because the science has changed such that people do not get AIDS, as we know, as much. It's living HIV cases. And so we want the money to reflect that because people who are living are the ones in need of housing. To offset some of the other changes, they're added in a poverty and a fair market rent factor. So the formula that the government uses to determine HOPWA is living HIV cases, and then a little bit accounts for poverty in a certain area, and then fair market rent in a certain area. And those two offset one another. And this is the new formula. And this is what the government uses every single year to determine the HOPWA amounts that go to any jurisdiction who is a HOPWA formula grantee. As you can see from the pie chart over here, 90% of HOPWA funds are formula and 10% are competitive grants. And that 10% means that agencies, jurisdictions can apply for HOPWA funds when they come up and available competitive funds, and that's 10%. I'll just remind everyone to please mute themselves. All right. Thank you. So the big thing is that many areas are going to be highly impacted by the new formula. And we are in the 5th year of phasing in the new formula. And the areas in black are the ones that are projected to get a good bit of new funding and increase of funding. And the red are the areas that are projected to get a decrease in funding. So everyone look here, and if you are in red, if your area is in red, it's going to be really important for you to reach out to your members of Congress, or if you're in DC, to your mayor or your council member. But these areas, so San Francisco, DC, West Palm Beach, Atlanta, Augusta, Georgia, Baton Rouge, New Orleans, Baltimore, Jackson, Mississippi, Jersey City, Newark, New York City, Philadelphia, Memphis, and Houston. These areas are poised to get a decrease in funding because of the new formula. All right. What have we been doing? Because we don't want to destabilize anybody, right? We don't want to destabilize jurisdictions, because we know that even in those cities that are going to get a decrease in funding, there are still waiting lists. These are successful programs that have housed people for many years. So you can see over the past several years what we've been able to do. HOPWA funding was stuck at $330 million for years, and actually was a little bit less before then, a few years before. But we went from $330 million to $335 to $356 to $375 to $393 to $410 to $430 million. So HOPWA is now funded at this year, fiscal year 21, at $430 million, which is still such a small amount if you think about all of the housing need that we have throughout the country and how expensive housing is. $430 million is so small. The Ryan White program, as you all know, is billions of dollars. So we're talking about a very small portion for HOPWA, but we know how necessary it is. So on this formula as well, I want to make clear that because we have gotten increases every single year for HOPWA, there has not been a decrease in any jurisdiction funding because of modernization. More than there are 2 jurisdictions that last year got a cut of less than 1%. So really, in effect, there is absolutely not any reason to say that because of modernization, your area has been cut in funding, because that has not happened yet. That has been a fear that has not happened yet, because all of us have worked together to lobby Congress to talk about the importance of this, and we have gotten more funding for HOPWA. Now, where do we go? So this is the last year of modernization phase-in. So this phase-in meant that no jurisdiction could lose more than 5% and no jurisdiction could gain more than 10%. So over the past 5 years, we've been easing it in and we've been adding money to HOPWA. Now, this year is the first year without any of those hold harmless provisions. This next year, fiscal year 22, is going to be the year where there are no hold harmless provisions, and we need as much money in the HOPWA program as we can possibly get. And so NAC is asking for at least $600 million. $600 million to the HOPWA program. And it's going to take all of us to get there, because that is an increase of $170 million. And Congress needs to hear from each of you. And we need senators, especially senators, but we need members of the House, but especially senators, to be reaching out to the Appropriations Committee to urge funding for HOPWA. And not just for HOPWA, but for other HUD programs as well. We know that housing, many people who are living with HIV get housing supports, not just from HOPWA, but from other HUD programs. So know that too. If you're needing housing, you don't have to go through HOPWA. You can go through your area's continuum of care, or get a Section 8 voucher. It doesn't have to be a HOPWA program. So that is what the summary of what's going on, though, with HOPWA, and we can now talk about what members of Congress need to do, and what each of us can do to get that going. So I'm going to stop sharing my screen, and I'm going to take a look at some of these questions. Feel free to chat your other questions, and we have almost 80 folks. So I'll answer some questions, and then we'll see how it goes from there. Do I know if LA will lose? So Los Angeles, I think, is slated to lose just a little bit if we don't get a significant increase. And I keep saying slated or poised, because I am determined that we are not going to lose, that we have got to instead message to the Biden administration, to members of Congress, that we shouldn't be getting cut. Instead, what they should be doing is putting more money in the pot for HOPWA, so that we're not trying to fight one another. So but I think Los Angeles is poised to lose just a little. And then Michael says, stable, affordable housing is a crisis, yet HOPWA decreases in San Francisco would be tragic on our HIV population. That's absolutely right. San Francisco is one of those areas. I will say that Nancy Pelosi, Speakerwoman Pelosi, has absolutely been very helpful and has been fighting for HOPWA. But for those of you in San Francisco, in California, please make some noise. Let Speaker Pelosi know that you want HOPWA to be increased, not only to protect San Francisco, but to make sure that New York doesn't lose millions. It would just be tremendous. Okay, Indiana, I didn't see that state listed, or Ohio. So Nick, I put the data up there of states or jurisdictions that we're going to lose a lot or gain a lot. So if your jurisdiction wasn't on there, it's in the middle. It's probably going to be at least flat funded, right? And for those of you who are interested, NAC is going to host a webinar, and we can go through what each jurisdiction could potentially lose or get. But I know some jurisdictions could. If you want the slide deck, email me. Let me put my email in the chat to all of you right now, because I've gotten a couple of emails. I'm happy to email this. I'm also happy if you want to email me and ask what your state might lose or gain. I am happy to go get my HUD data and find that for you. And then William Scott Daly asked, the increase from 430 to 600 million, would it prevent decreases to the listed red states and jurisdictions? The 600 million would mean that every jurisdiction would be flat funded, except for Atlanta. If you are an Atlanta folk, I would love to talk to you. We're working with people in Atlanta, but 600 million would absolutely satisfy every jurisdiction except for Atlanta. Atlanta would lose a little bit, and we are working with Atlanta on that. And that's why we're saying at least 600 million, because it would be great for Atlanta folks to raise a stink. And we have 2 new senators in Georgia, Mr. Warnock and Mr. Ossoff, and we are hoping that they can really throw some weight around on this too. Let's see. Folks who are getting excited about housing, this is great. And then let's see. And then Whitney said, we encourage you to share lessons learned on social media today. We'll be amplifying your posts all day long. So use that AIDSWatch hashtag. I know that you've been reminded throughout the day, but use that. And if housing has played a role in your life, it would be so great for you to tag that. And we can publicize that as well. If you're interested in telling your story about how housing made a difference for you, please email me. I would love to elevate your story, get
Thanks.
you.
I got it. I got it right here in my hand.
If everybody will mute themselves, please. All right. What is the reasoning for the projected decreases? That's one of the questions. So this is the formula change. This is what I was talking about. So it used to be that formula changes were, or the formula was based off of cumulative AIDS numbers, right? Cumulative AIDS numbers. So since the beginning of time. And when we changed that to living HIV cases, people who are living with HIV who are in need of housing, that made a huge difference in what areas we're going to get, because we have seen that the HIV is more prevalent in the South now, right? It is more prevalent in rural communities. And so shifting money to those new areas means that it's taking money away from the big areas. And it wasn't personal. It wasn't, it wasn't like some jurisdiction did something wrong, but a lot of folks in the South and a lot of folks in other places, and not even just the South, Chicago's going to get more money. It's just the epidemic has changed. And so we need help. We need HOPWA to catch up with Ryan White. So that's why the formula changed several years ago. Obama signed it into law. And over the past 5 years, we've been phasing it in. Fiscal year 22, next year's budget that Congress is deciding right now, is the first year of the new formula. And that's why we absolutely need everyone. So a question, 400,000 is the unmet need. HOPWA currently funds 150,000 households. So 400,000 is the unmet need. That's what HUD estimates of people who are low income and living with HIV. And when you're, spending more than 50% of your household, of your income on housing, we say that you're at risk, right? Because one paycheck away from losing your house, that's not very stable. So HUD's estimate is that 400,000 people would be in need of HOPWA or would qualify for HOPWA. HOPWA right now provides supportive services and housing services to 150,000 households. It only provides direct housing to 55,000 households. So think about that for a minute. Only 55,000 people living with HIV are able to get HOPWA assistance because it's only 430 million. We've made a lot of gains. I mean, we've increased it by 100 million, but that's still, if you think about 430 million divided by all the people who need it, the money that it takes to run a program and the staff and the caseworkers and everything, it's not a hell of a lot of money. So what we're trying to say is you've got to just not give us a little bit, but a lot. So HOPWA is able to currently serve 55,000 households directly and provide supportive services like utility assistance or transportation, food, that type of stuff. Makes up for non-medical case management. So if job supportive services, those are other supportive things that HOPWA can provide. So that is one thing as well. Any other questions, please? Questions, thoughts in the chat box. Okay. Did this new stimulus bill provide reimbursement to landlords for lost rents during COVID through PPP monies to small businesses? Yeah. So the COVID bill, okay. HOPWA got $65 million in CARES Act funding, and that $65 million is able to go and help clients. So if you get HOPWA monies or you know of a jurisdiction that does, they have an extra amount of money to go to assist right now. However, some of the other funding that has happened through CARES Act and other stimulus bills has provided financial assistance for landlords. The thing is that landlords need to trickle that down to renters. So that is a rub there. But yes, landlords did get money. They can apply for PPP loans. Okay, my landlord applied, is waiting for the state to respond. Yeah, I mean, each state is handling their CARES Act funding differently and all of their stimulus funding differently. It took HUD a while to get the money out the door, and then the state's got to figure out what they're going to do it. There are just so many understaffed housing agencies and government agencies. We're seeing a lot of slowness on this funding, which is a problem. Any advice on advocating for more funding for TBRA? Well, Katya, so that's what we need to do is increase HOPWA funding, and then the HOPWA funding can go towards tenant-based rental assistance or short-term mortgage, rental and mortgage assistance. We need to make that whole pot of money for HOPWA bigger, and then jurisdictions and agencies can figure out what they're going to do with those increases. Let's see. In LA County, we use a lot of our money for STIRMU to keep people housed. Don't have much housing stock for people looking for housing. That is a problem. We also have been advocating for HUD to change their fair market rent definitions. So if you're a case manager, a social worker working at a housing agency, you know how hard it is to find somewhere that'll accept that low voucher. So we've got to change the amount of money that those vouchers are eligible for. And that means lifting the fair market rent caps. And the CARES Act funding did that. So the money that came through for CARES Act has many waivers. They can call an Uber for you with those CARES Act. They can send food to you through an Uber. They can provide wireless phone services, lift on fair market rent caps, virtual inspection so that somebody doesn't have to go to a housing place. So if you're curious about that, the HUD the resources have a lot about all the flexibilities of that CARES Act funding. And we absolutely need those to stay in place because a lot of places that get HOPWA money struggle to spend some of it because of those caps. All right. Urban and landlord economics with gentrification have also played a role in displacing large numbers of people. There needs to be advocacy for more social housing models to keep vulnerable tenants protected from the markets. I could not agree more, Michael. Yes. Thank you so much for sharing that. There need to be far more programs to protect landlords. Did the new stimulus continue providing rent utility assistance for people living with HIV processed through ASOs? Yes, if your aid service organization already gets HOPWA funding, they should already be in touch with the jurisdictions that got the CARES Act funding, and they can apply for more funding. The jurisdictions had to submit a revised plan. Let's see. Janessa, I see this chat. I'm using my personal phone, a solution for the iPhone. I do not know. I'll let somebody else answer that for Janessa. I hope you get it figured out. Any other questions about or comments about housing in general or the need? Would y'all like me to go into some advocacy, some things that what I would love for you to do when it comes to this? Okay. All right. I see a thumbs up. So I'm gonna get onto this. Okay, great. So number one, find out, if you don't know, find out who your legislators are in Congress. This is HOPWA funding as a federal issue, right? So this means that you need to be contacting your United States senators and members of Congress. And what is important is that you tell them that HOPWA needs to be funded at least 600 million. 600 million. At least 600 million. You can thank them for the previous year's allocation. And I will say that we need to hone in on the Senate more than anywhere. The House continues to propose to give us an increase, and every single year the Senate proposes to flat fund us or cut us. Last year they flat funded us in the Senate, and that was a win, which shouldn't be the case. When it came out, once they reconciled, we got an increase, but we really need to hound our senators and tell them about the new formula. Tell them that HOPWA, hey, I'm not sure if you know this, but HOPWA got a new formula a few years ago. This is the first year of full implementation. The first year of full implementation. It is critical that we invest in HOPWA, not only for this, but because we know that there are approximately 100,000 people living with HIV who are experiencing homelessness. We saw how critical it is in COVID, right? COVID's an epidemic. Well, so guess what? So is HIV. So throw some money to our way too. Invest in housing. I've also had many senators say, well, why can't HOPWA just be part of Ryan White? Why can't HOPWA live at Health and Human Services? Because HOPWA is within HUD, the housing program. So what we need to say there too is that we need people who are skilled at housing, not just health, but people who are skilled at housing for reaching out to us to help with relationships with landlords, to understand housing laws, to understand zoning laws. We need HOPWA because it makes sure that it is a special pot of money that marries together the health component and the housing component. So I think stressing to them, and if you have a personal story, not even with HOPWA, but say how you got us, you were able to afford your own place to live for the first time and what that meant to your health or to you being able to get a job or your own happiness, whatever it is. Legislators need to hear the personal story, and they need to hear how maybe case managers helped as well. But that this absolutely needs to be part of the HUD portfolio. HOPWA needs to be at HUD because this is a housing program. It has health outcomes, but it's about housing. So that's something. But really, see, Chuck, some clear, simple bullet points would be great. Yeah, policy briefs, excessively long. That is not helpful. Yes, housing is healthcare. Why doesn't HOPWA help people with condos or homes? They do. So HOPWA can do that. HOPWA has short-term rental or mortgage assistance. So if you need help with your mortgage of your condo and you're having a hard time, go in. HOPWA can still help you. Rental assistance as well. It's not there. HOPWA can look very different. It's not just about putting someone in a HOPWA building next to an aid service organization. It's also about getting a rental voucher or helping you stay in your own home where you are. So if you're experiencing financial issues living with HIV, then go to your case manager, go to your aid service organization. If they don't administer HOPWA, ask them who does. There are ways to get housing. And if HOPWA isn't in your area, you can go to your regular continuum of care, so that you can, go and get a Section 8 voucher, like I said, or some other supportive monies. You asked to advocate for $600 million. What is the current award amount? Right now, we are at $430 million. $430 million. Yes, housing is healthcare. Is HOPWA a payer of last resort? We're asking for an additional $170 million. Yes, Paul, and we're asking for an additional $170 million. It is a big ask. Is HOPWA a payer of last resort? Not like Ryan White is, no. And what you no, you can go to a HOPWA program, and you just need to demonstrate your need. And each jurisdiction has their own specific ways of determining need based on area, median income. You do have to be living with HIV. It also, HOPWA does provide family housing. So if I'm living with HIV and I have my 2 kids, HOPWA will provide a home for all of us, but I'm the patient. I'm the client, because I'm living with HIV. So that's how HOPWA works. Now, Ryan White does provide housing. So this is not just about HOPWA, this session, but Ryan White does allow for Ryan White monies to provide housing. However, that money is payer of last resort. So Ryan White is payer of last resort, including for housing. And also Ryan White housing funding is supposed to be short-term. So it's more emergency, short-term based, whereas HOPWA can provide permanent supportive housing services, which is really important. Okay, so does the 400,000 person unmet need include people experiencing homelessness or just folks with a high rent burden? Both. That 400,000 are people who are experiencing homelessness or who are on the verge of homelessness. And this is an estimate of 400,000 people who need money for to help with housing. Jay shared, in my area, HOPWA has a long wait list. Absolutely it does, because we need more funding. And this makes me so mad because so many people have been on HOPWA waiting list for years, or their area says we've closed the waiting list because it's so long. I know. It is a huge problem, which is why we've got to tell Congress we need more money. It's not just about the new funding formula. It's about this huge problem that there are so many people who want to be in HOPWA or need supports and can't get in. And we have just been severely underfunded. So, next question. Does HOPWA assist in moving costs? I do not know the answer to that question, and I know that I should. If somebody else who is on here and knows, go ahead and jump in. But I can't remember whether it does or not. Chuck's question: what specifics can we share with legislators that would support the $170 million? So that would be what I would say is that 100,000 people are living with HIV who are experiencing homelessness, that in New Hampshire, there is a 6-year long waiting list. You say, hey, my buddy Chuck has been waiting on HOPWA for years and years. What does it mean to a Republican legislator that is concerned about the deficit? Chuck, that's a great question. What I would say to the legislator is that who's concerned about the deficit, that the money has already been allocated by that point. So you got to give it somewhere. And secondly, it is a hell of a lot cheaper to house someone rather than pay for medicines that get stolen when you're living on the street or when you're having to go to the hospital. Hospital costs are far more expensive than paying for someone's housing. So I would talk about the cost savings. If you are talking to a Republican legislator, tell them that each new HIV infection avoided saves the country a lifetime of $500,000. That's a Republican talking point. It saves almost $500,000 in lifetime costs every new infection that is avoided. You can also talk about, just to Republicans, the public health issue, right? That HIV is transmittable. And I know that we often don't like to talk about, this isn't the thing that we usually talk about, but what you can say is that, yeah, if you're experiencing homelessness, you might have to engage in unwanted sex work, for folks who don't want to be in sex work, but feel like they need to get by, or folks who are exchanging needles, or folks who, other high risk activities that can increase transmission of HIV. So that is something that Republicans might care about. Also, I wouldn't assume that a Republican legislator wouldn't care about the human aspect of it. To just say, look, there are all these people who are homeless, and there are people who are sick, and people who need your help. Okay, do we have a sense of how many people are on the waiting list across the country? If not, how will we go about finding that information? Warren Gill, where are you? Email me. If you want to work on this project, you let me know, because I have been trying to reach out to all HOPWA jurisdictions to figure out how long each jurisdiction's waiting list is. And if somebody wants to help volunteer with that project, let me know. But I will tell you that HUD does not have this information. No one has this information. I would love for us to actually apply for a grant and spend some time figuring out what the real need is and how long the waiting lists are. And I will also say that some places just close down their waiting list because they know that they're not going to have more monies coming in, or they're afraid of that. So they don't keep a waiting list. Okay, time is critical, particularly for long-term survivors and aging populations. Absolutely, time is critical. And one thing that we're gonna, as I talked about in the beginning of the aging, there are so many people who are aging who are maybe worried about going into a assisted facility or nursing home, because then going back into the closet, whether that's gay or your HIV status, do the nurses and doctors know how to treat HIV or other co-infections? What about drug users? Are all these places adept to dealing with these things and being supportive? So we really need to figure out ways of getting HOPWA programs, HOPWA agencies, maybe to start, and Ryan White programs, to start building great facilities for people who are aging. I would love to see that. Great. Alfredo shared HOPWA does assist with move-in costs through rental startup programs. Thank you so much. Wanda shared real stories about people in their districts. Yes, when you go and meet with your members of Congress, share those things. Does anyone know how long the HOPWA waiting list is in New York? Yes, I do. It depends for different programs, but I know that some of them are several months long. Let's see. Yes, I will put my email address in. Do we know how many new people are homeless due to COVID taking their job away? Yeah, not yet, William, because a lot of folks have not been evicted because of the eviction moratorium. And so what we expect is that right now, a lot of people haven't experienced homelessness yet. So they may have lost their job, but they're sitting in their house and hoping to find a job, hoping to get rental assistance once, as soon as they can, but just praying, hoping that eviction moratorium stays. So I don't have a number yet of how many people have lost their homes, but I'm afraid of that. And that is why HOPWA has an extra $65 million. And that is to prevent. So that $65 million is in addition to our regular allocation just to help with COVID. So do know that support is out there. Paul says San Francisco's HOPWA waiting list years and years. Yeah. Thanks that Michael put my email address in. Yes. Lauren K at nationalaidshousing.org. Let's see. Yeah, no such thing as a geriatric HIV specialist. That's a problem. Leslie shared my email. Thank you. Alfredo shared more about rental startup, which is super great. Thank you. Nick shared his experience. Paul shared more. Yeah, you're right. It is a tsunami on its way, and we've got to be prepared. And we've got to be prepared for potentially a new onslaught of HIV infections. I mean, I don't know about you, but I haven't been going to the doctor as much during COVID because I haven't been wanting to go into a doctor's office. How many people have been avoiding going in for routine testing, or how many folks have been avoiding going into a doctor's office to get their meds renewed. So that's something. I have another slide I want to share with y'all real quick. Let me find it, and then. All right. Let me share this real quick. Yes, telehealth. Not everybody has telehealth. Look at this slide. So 20,000 for an average single tablet HIV regimen for a year, compared to 11,000 on average for a one-bedroom apartment. Now, before those of you in San Francisco, New York freak out, this is on average, a national average. This takes into account Oklahoma and Alabama too. But if you look at just that data, that members of Congress are, great with Ryan White and investing all this money into pharmaceuticals, which is great and goes to a pharmaceutical industry too. But think about the cost of that compared to the cost of housing. And what's really important is that we treat the whole person and not just the medical piece of it. And that's what we have to convey to legislators as well, is that to make sure that someone is whole and healthy, we have to treat the whole person, and that includes housing. And housing is a heck of a lot cheaper a lot of times than those medication regimens. So let's see, any more questions since I shared that? Increase in referrals here for new diagnosis. Yeah, Janessa, I'm very curious about that. Many frontline agencies have stopped testing. Mobile testing has halted. Yeah. I mean, who's going into bars and getting tested right now? Or, out and seeing a mobile testing unit and also like, I know that people are still, doing activities that might, result in an HIV diagnosis, especially while we're all, hibernating at home. Okay. Let's see. Am I able to share the slide deck? Absolutely. Email me. I'll send you the slide deck. Housing as healthcare not only helps folks with HIV, but folks with mental health issues. That is actually something, thank you for Paul for bringing that up, because that is a great point, is that HOPWA provides a lot of mental health support services and a lot of case management services. And that is really critical. And it's critical to keeping someone housed, right? To making sure that people's mental health is taken care of as well. Thanks, Carlos. Hello, Rosa. Where does a homeless person keep their meds? That's right. And then cops tear down tent villages and meds are taken and not returned. Also, that happens so much. Or people who stuff gets stolen, or somebody just sees a bunch of pill bottles and thinks there's something good in there and doesn't know that it's a AAA, well, I'm sorry. So I think, it's really hard for that. And then what about eating healthy if you're experiencing homelessness? Or what if, I know that a lot of agencies have seen folks who have been able to financially make it up until lately because of COVID. And so folks who are for the first time needing help keeping their current home, they're housed, but they're scared of losing their current home. Let's see. Are there other housing resources for people living with HIV that are outside of HOPWA? Yes. So you don't have to qualify for HOPWA. You can go and apply for other housing supports at any, you can Google your housing continuum of care, which is the pot of money that helps for homeless persons, or just your local housing authority, and going and applying for housing. Any other housing nonprofit, yes. And if your HIV is managed and you don't feel like you need extra supportive services, that's a great thing to do. Get housing assistance somewhere else. How can housing help in case of hurricanes or earthquakes with people who have their own house and have a positive HIV diagnosis? Let's see. How can housing? Yeah. So the answer to that is that first of all, you can also go to FEMA. There are other housing programs that are available during disasters, and so it does not need to be HOPWA. But HOPWA can also assist in these types of things for procuring a new home and assistance. So whatever the situation is, you should reach out to your local housing agency. Craig, yes, thank you, Craig. Ryan White funding allows for housing assistance. And just to reiterate, Ryan White Ryan White is payer of last resort for housing. So if you can't get housing through other places, Ryan White will pay. And it's also a shorter term. And not all Ryan White programs do provide money. They're allowed to, but they don't always do, because think of states that haven't expanded Medicaid. Their Ryan White programs are paying for medicine and ADAP programs and those things. And so some Ryan White programs are overburdened and don't have any money to spare and see housing as a secondary thing and know that HOPWA is there. That's a really good point too, because I've had plenty of legislators say, well, why can't Ryan White just provide housing? They can provide housing. The fact is, and you should tell your legislators, not all Ryan White programs do provide housing, and it's different housing. It's not long-term supportive housing services like what's in HOPWA. And Craig said, preach, I'm in Florida. Yes, no Medicaid expansion. Yeah. So these are great questions. I really appreciate all these questions and thoughts, and hope, and it seems like we're all learning from one another here. So this is really great. Any other thoughts or questions on how to present to your legislators about the need for housing? I am really hopeful about us being able to get $600 million at least for HOPWA, but it's going to take all of us. It's going to take all 90 of us on this Zoom. It's going to take everybody at AIDSWatch, and otherwise, it's a big investment. $170 million more into HOPWA. That is a lot of money for a small program, but we can do it. We can win. Anything else? I don't know if all the Q&As will be available after the conference. If you want the Q&A, I would go ahead and copy and paste. And Ashley just put some things in there. Oh, Chuck, thanks so much. I'm putting my email address in just one more time. And then let's see, Paul, one hit issue in San Francisco is when the city publishes the unhoused population, they are only referring to those who have substance use and mental health issues. Yeah, I mean, it's crazy what different jurisdictions gather and how they define things. This is why we need to figure out what a real housing need is. I mean, I'm wondering, does HOPWA really need to be funded at $1.2 billion? I would love to go to Congress and say that, but they're going to say, where'd you get that number? And I'm going to say, I don't know. That's just what I feel, because I know that there are a lot of people out there in need of housing. So if we do 400,000 times $12,000 a year. What's that? It's a lot of money. Let's see. Thank you. Okay, so it looks like folks are starting to trickle off a little bit, which is fine. We don't have to go the full amount of time, but I'm happy to stay on and answer more questions and give feedback. If you want the slides, email me. Please don't put it in the chat because I'm not saving the chat. So if you want them, please email me so that I can, in one swoop, send it all to you. Ryan White housing is a category of service that will need to be prioritized by your local TGA or EMA in order to be funded. Then a percentage can be awarded. That is absolutely right, Robert. Thank you so much. So your Ryan White area needs to present that. They need to apply for that and designate that as a category. And I will also share that right now, Ryan White only I think 3.5% of Ryan White funding goes to housing. I looked at it yesterday. So, and it's not even more than 30 million of Ryan White dollars go to housing. So it's not very much. Yep. Email me. I'll get you the presentation. And then another thought that I had, something about housing that I was going to share with you. It's gone. I had some thought. It'll come back to me. Any more questions? And we can get you some fact sheets as well. We have some. We also have letters. We also are calling for organization. So if you're part of an organization or represent an organization, to sign on to our letter. And this letter is coming from the National AIDS Housing Coalition asking for $600 million to Congress. And we will, gathering all those organization names, and then we'll send it on to Congress. What is being done to counter fraud in Ryan White HOPWA housing? I do not know. I did not know that was a huge problem. So if you want to email me offline, I'm happy to get you in touch with someone. As we've shared, Ryan White is able to provide housing, but doesn't always. So it may be that. The other question or the other thought that I had was that it is important for you to go to your planning councils and all of these ending HIV meetings and plans and all that. Make noise. Say that housing has to be part of this, and it can't just be little pots of money, but it needs to be a coordinated system to providing housing. And it does. We do need to look at just affordable housing costs in America and gentrification and all of those things. But for right now, it would also be great if all of the administration and states would put more money into specific housing for people living with HIV. That is right now what is number one on my mind. Are there any innovative programs being discussed, like expanding social housing or land trust or other initiatives through the administration? Yes, Andy. The next couple weeks are going to be all about infrastructure in America from the Biden administration. So more tuned on that. I think that land trusts are amazing. So for those of you who aren't familiar, say your grandmother well, maybe not your grandmother. Your aunt is 85, 86, whatever, doesn't have children, dies, has a home. There's no one it's left to, and it just sits there and deteriorates. Well, after so long, a city can take that back, and then a person an organization can apply to basically get the deed to that property, and it pay for all the legal fees and then get that, and then we can build supportive servicing in a lot of areas that have these, broken down areas that haven't been invested in, but have good land. Let's see. How are we expanding our political imagination to envision a more just future? That's a great question. And I think also we need to think about, what's our dream for treating, someone who has many needs. What's our dream to ending HIV? Let's think creatively. Let's not think and just tweak what we currently have, but what do we want? Where can I learn more about TBRA? I never heard of it. Great. I'm glad that is helpful. So you can, HUD has a ton of resources. The HUD Office of HIV Housing defines things, but you can go to your local HOPWA provider. So an aid service organization can tell you who your HOPWA provider is, or they may be your HOPWA provider. So go to them. Is Nashville getting any of the HOPWA money? Yes, Nashville gets a HOPWA grant. Yes, it's formula. So again, your cities aren't having to compete for it, or your states. It's just allocated through the federal government. Kelly, regarding fraud, HOPWA is very closely regulated. Yes, it is. There is a ton of red tape. And so I am not sure of much room for fraud. I agree with Kelly in the HOPWA program. And I'm not sure about that Ryan White fraud question. You can email me offline. Arizona isn't good on housing.
Excuse me, about the HOPWA fraud question. That was posed by me. It's when redevelopment agencies utilize HOPWA grants and give them to a developer who, instead of turning it into AIDS housing, it turns it into high price lofts. Is there anything done where that's occurred? Because it's happened in a lot of major cities, especially Los Angeles, to get back that money. I know of developments for HOPWA where you don't have a single person with HIV housed.
Yeah. Okay. So if that's the case, and we're keeping ourselves muted, but I appreciate your question. No, that's okay. Email me, and then we'll put you in touch with HUD, and HUD would absolutely want to investigate that.
I respectfully disagree, because HUD is often the perpetrator of these types of frauds. Is there any legal entities within the HIV community that is providing legal services for people who are defrauded out of HOPWA housing, and the community who's defrauded out of HOPWA housing? And also, is there anybody who's actively working to reverse the discriminatory laws that require people who utilize marijuana to be evicted from HOPWA housing, even when they're in the last stages of life?
Yes. So why don't you email me, Louis?
Yeah.
Okay. Email me. And each HOPWA jurisdiction has their own rules around drug use. There are plenty of housing first models with housing with HOPWA. That's not a universal rule across the board. And there are fair housing law firms, and I know that there are some legal groups within the HIV space, but this is not something we hear a lot of. So I'm happy for you to email me.
Okay, thank you.
Maricopa and Pinal counties aren't even in the budget of the state. That's Phoenix and Flagstaff. Yep, it's some big cities get the funding, but then other smaller cities don't. And so then sometimes people, if they want to have HOPWA, have to move to the bigger cities and leave their families behind in rural areas, which is a huge problem, which is one reason that we wanted the modernization, is so that more funding can go to the areas that need it. Exhausting to prove you were on the poverty line over and over again. Yeah, Nick, thanks for sharing that. And I think, y'all telling members of Congress this too, that the burden being on the person living with HIV is too much. And especially if you have to go to one place to get Ryan White and to get your meds or your case management, and then somewhere else for housing, there needs to be more central intake and not as much paperwork. I agree. In a state, is it generally only one agency that provides HOPWA, or is it more than one agency? It depends. Usually the state, getting comfortable. I just had back surgery, so readjusting. Okay, so in a state, is it generally only one agency that provides HOPWA? So the way that it works is that states who qualify get a pot of money, and that goes to the state. And then if there is a city that also qualifies for HOPWA, the money goes to those cities as well. So I know that in New York State, for example, New York State gets a pot of money, but then New York City also gets another pot of money, and Sarasota gets another pot of money, and so does Albany. So then in the state of New York, you have maybe at least 5 HOPWA grantees who each run their own programs. So it does depend on each different state, but usually the state gets money and then different cities get the money. Accessibility is a huge issue. Yes. What type of accessibility? Please chat. Being able to access HOPWA or what? I love all this communication to one another on this. Any other questions? We have 15 minutes left. Yeah, that's, it's interesting on marijuana. Let me spend some time on, there are 2 of you now who have brought this up. And especially as states change their laws, what do we do with federal housing and drug use in a place where marijuana is legal, or even if it's for into life care, as Louis brought up, or pain management, or hell, recreation. I don't care. What do we do? So we need to make sure that that's provided for. But I do know that there are many housing first initiatives, and that there are some HOPWA programs that work with drug users, not just marijuana, but other drugs. Access to basic information resources, accessibility to access HOPWA is hard. Technology is also a barrier faced in terms of competency. It is. I also would say that in infrastructure, we need to be talking about broadband. We need to make sure that everywhere has access to good internet, especially when we're putting so many meetings on the internet, or resources or forms to access things. So we need to do that as well. Yes, Wanda, I thought that marijuana came under the housing first guidelines, but it might be different in different jurisdictions. So this is why I need to spend more time on this. Any national orgs that are working on housing as a human right to create new housing programs for people living with HIV and at risk? Yeah, I think there are several organizations. I know that Age United thinks of it this way. NASDAD's working on housing as well. National AIDS Housing Coalition, we're in lots of conversations about housing as a human right. We shouldn't have homelessness at all in America, right? That just shouldn't be a thing. And MAC, thank you, Wanda. Yeah, there are lots of agencies doing work on this, and I urge you to get involved as much as you can, and at local, planning councils. Just make sure that housing is a piece of this, and if it's not, bring it up. Waiting to see if there are any more questions. This has been so robust. I appreciate it. And I've seen that that lots of folks have emailed me already, which is super great. So I will get you the slide deck, and I will also make sure that those of you who have emailed me, if you want, can be on the National AIDS Housing Coalition mailing list. Oh, we're hiring. That might be interesting to some of you. I am looking for someone. This is a selfish plug here. I am looking for someone to work, I don't know, 20 hours a month. It's a side gig to manage our social media and newsletters for NAC. We are paying $20 or $25 an hour. So if you are interested, please email me. I would love for someone who has interest, who knows about HIV and housing. So you are all a perfect audience, but also someone who wants a part-time job. And I'll put my email in again. Remember, email me. Don't put it in the chat if you want the slide deck, because I'm going to close this slide deck and this chat, and then I'm not going to have it. So email me if you are interested, if you are well versed in social media and technology, and also obviously you have an interest in HIV and housing. So go ahead and email me if you're interested in a position, and I can send on the information to you. All right. Well, we're close to time, and the questions are petering out. So I'm going to give it 3 more minutes, and if there's not another question in 3 more minutes, we will close out. So thank you all for coming to this session. Thank you for your interest, and there are several of you want to follow up with. I just put my email address in the chat. It's laurenk@nationalaidshousing.org. When you meet with your legislators, please, please, please tell them to fund HOPWA at $600 million. I put it in the chat. Fund HOPWA at $600 million. That is our ask. We need it.
Thank you so much, Lauren.
You're so welcome, Margaret. Yes, or word it as an additional 170 million at least, and tell them that this wouldn't even touch all the housing that we actually need, but this gets us closer to where we need to be.
Mm-hmm.
All right, thank you all.
Thank you.
This was excellent.
I'm so glad.
Thank you.
Thank you.